The plan to build a new hospital in Kenya did not begin inside the government offices. It began with frustration. For many years, Kenyans have been promised free and affordable health care. Different governments have launched programs meant to ease the burden of medical costs, yet ordinary families still face the same struggles. A cancer patients are forced to raise millions of money through Arambis. Mothers continue to die during childbirth. And emergency cases are often turned away if a patient lacks insurance cards. Even with the launch of a social health authority, many Kenyans believe the system is filled with a bureaucracy, hidden charges, and delays. This frustration has now turned into actions. Young Kenyans, most of them known for their presence on TikTok, have declared that they will build their own hospital. They said they are no longer willing to wait for government promises. What makes this different from other campaigns is the scale of the projects. The target is not a small clinic or a local dispensary. The plan is for a large modern community-owned hospital built at the level of the National Referral Facility. The focus is on specialized treatment for cancer, heart disease, maternal care, and emergency services. The group has already announced its fundraising goal. They want to raise 1.5 billion Kenyan shillings, which is about 11.6 million US dollars. On the surface, this amount sounds too ambitious, but the organizers point out to the strength of Kenya's online community. Millions of young people spend hours on TikTok with audiences that are larger than some local television stations. In the past, online fundraisers have shown surprising results. One viral campaign recently raised over 2 million shillings within a few days. With the energy of local youth and support from the Kenyans in the diaspora, the group believe the hospital plan is possible. The fundraising strategy is already being tested. TikTokers are using live stream, online challenges, and donation drives. A platform like M-Pesa, TikTok-owned fundraising tools are being used as collection of points. Support is not only coming in the form of money. Engineers, architects, doctors are volunteer their expertise. Plumbers and electricians are offering their services for free. Diaspora Kenyans are pledging donation from abroad. Volunteers are also coming forward with skills to help with the planning, legal advice, and technical requirements. The blueprints of these proposed hospitals are being prepared by professionals who have chosen to follow a team. Legal teams are guiding this group on the registration of non-governmental organizations to manage the hospital project. Talks are underway on how the facility will be run and how services will remain free. The organizers insist that unlike a political fundraise where money are often disappeared without accountability, this project will be open and transparent. Every shilling collected is to be accounted for. The reaction from the public has been strong. Many Kenyans say they are tired of waiting for leaders to deliver on healthcare promises. They see this as a direct response to government failures. Some have even pledged to support the hospital by volunteering to cook for patients or to provide other forms of unpaid services. This growing wave of support has placed pressure on state officials who are now watching the movement closely. A part of the anchor that come from the change in healthcare policies after the change of a government. Under the previous regime, healthcare was seen by many to be more affordable. The current administration introduced a new system and abolished some of the old ones, which the citizens say has only made healthcare more expensive. This has created a sharp contrast between what the leaders have promised and what Kenyans are experiencing in hospitals. When the new president came to power, he declared that every Kenyan should receive a treatment without being asked to pay first. He said that under the new insurance program, outpatient services at the dispensary, healthcare centers, and some hospitals would be free for all registered citizens. However, Kenyans have continued to report that hospitals still demand payment and that access to free treatment is rare. This is one of the many reasons why young people decided to take matters in their own hands. The organizers say this is more than a construction project. It is also a way of proving that young Kenyans can organize themselves without relying on politicians. They point to the larger protest that Gen Z organized in 2024 and 2025 as evidence that young people have the numbers and the energy to push for change. The hospital plan, they say, is a simple next step. The challenges ahead are many. Land has not been secured legally with full ownership documents. Approval are required from the Kenya Medical Practitioner and Dentist Council. A specialized machine for cancer treatment and intensive care will need to be imported. Skilled doctors, nurses, and technicians must be recruited. Running a hospital also means ensuring constant supply of drugs, equipment, and staff salary. But the youth movement said it has already begun to address each of these issues by involving experts who are willingly to advise and volunteer. For example, other countries are like and also encouraging the group. In Uganda, local community have come together to build a health facility through donation. In India, crowdfunding has been used to support hospitals and sustain them over time. These cases are being used as evidence that Kenya initiative is not impossible. What makes this story stand out is the sense of urgency among ordinary Kenyans. They are no longer asking the state to act. Instead, they are taking responsibility for sectors that directly affect their lives, with mothers, children, and poor suffering the most from lack of affordable care. The promise of free community hospital has quickly attracted national attention. Government officials are aware of the movement. Reports suggest that some are worried that the hospital project is sending the message that the state has failed in its duty. The pressure is made worse by the fact that the president himself once promised universal free health care by building a facility outside State House. Young people are publicly holding the leadership to account. The story of the hospital is still in its early days. The fundraising has started, volunteers have come forward, and the plans are on the paper, and the conversation are continuing among doctors, lawyers, engineers, and ordinary Kenyans who want to see the project succeed.